Now, we just earlier spoke about the gap between retirement and Medicare, and a new survey shows that most Americans don't expect to work beyond their early 60s. They're looking at giving up their full time paycheck at 62, and Yahoo Finance's Carrie Hannon thinks, well, that's a terrible idea.
Unless you absolutely can't continue working because of a physical issue or you can't get a job because of ageism. And that's very real. But, it's a bad idea because in a sense that they have medical bills. If you leave at 62, you still have to foot your medical bills until 65 when Medicare kicks in. And even then, Medicare doesn't cover a lot of things. People are mistaken there. So I think people don't factor in some of these things like inflation and then, of course, longevity. We are living longer lives.
These factors, if somebody comes into the office saying the only thing holding them back from retiring early is actually their healthcare coverage, what would be your advice to them?
I think that is a common concern. In fact, one of the presentations that we have going on right now in Northwest Ohio is discussing the issues of healthcare. And really, when you look at healthcare, there's three phases. So the first phase is looking at your healthcare cost pre-65, navigating the Affordable Health Care Act. Number two is transitioning into Medicare, understanding the difference between, a Medicare Advantage or a supplemental plan, figuring out, what are the gaps in the coverages and what are the out-of-pocket maximums. And the third is the issue of, addressing long-term care because your Medicare and or traditional health insurance is not going to cover a nursing home stay. So we do have several different events that are coming up here in Northwest Ohio. If you go to arhq.com, and if healthcare costs are the area that's holding you back, I would encourage you to come out there. We're going to give you a couple of specific strategies on how you can have better peace of mind and navigate it. Giving you an example, I just went on to the healthcare.gov website. And if you haven't gone on there before, I'd encourage you. It's got a wealth of information, but luckily being that I'm insurance licensed, luckily that we have, Scott here at the office running our America's Medicare Associates, this is an area that we can navigate maybe a little bit faster than somebody who's not familiar with the website. And what I was doing is I was looking at different scenarios to help you, our listeners, have an understanding what the affordable healthcare looks like for different levels of income. The first thing that you need to understand is you need to understand affordable health care is an income, not an asset test. So it doesn't matter how big your 401k or your personal investment savings are. What's going to count is the number that you end up with on your tax return is going to determine what your countable income is. And when you go into the calculator, what you're going to do is you're going to type in some information inside of there. The goal to keep affordable healthcare costs down is to know where your levels need to be and know what the differences are. Essentially, what you want to do is you want to have your income to be low enough that you don't fall into Medicaid and get into that healthcare system, but you want to have it low enough that it keeps it affordable as well. Using an example here, what I did is I looked at a husband and wife age 62. These numbers are as of June 3rd, 2024 when I ran them. What we had is a $45,000 a year income for a couple. The lowest premium, if they picked the lowest premium plan, was $0 out of pocket per month. It did have an $8,999 deductible and an $18,800 out of pocket maximum. So we oftentimes will run into healthy couples that haven't really had, much major health issues that have gone on. Their goal is, maybe retire at 62, make it to 65. And if they have no health insurance, and using this example, if they keep their income to a countable level of $45,000, then what that means is that according to the website right now, their premium is $0 for health insurance. And unless they have some type of emergency come up, where they're going to pay that deductible or that out-of-pocket maximum, then they're going to be in pretty good shape to be able to, be confident about what their retirement needs are. And the way that we do this and the way that we've helped out a couple of different people, again, is knowing when to draw Social Security. So Social Security is a countable income source. So delaying Social Security may work out better so you don't have it show up as a countable income source. The second thing is many retirees think, well, I retire, I'm just going to go ahead and start taking money out of my 401k or IRA. Those are countable income sources. So again, those numbers are going to work against you to determine what your healthcare cost is. Things like your personal savings that are outside of retirement accounts, those spending those assets in those early years are not countable sources. Things like Roth IRAs, there can be other vehicles that you can use to pull income to keep your income down a little bit. So again, you maybe want to have a little bit of Social Security, maybe have a little bit of withdrawals from traditional retirement accounts, but using that $45,000 example, a married couple age 62 can have zero out-of-pocket costs under affordable health care. Now, if we bump that level up to $100,000 a year, and $100,000 a year, the premium goes to $357.68 a month, and the deductible goes up to $15,000. The out-of-pocket stays the same at $18,800. So that's $4,292 a year in cost, plus the deductible goes up by another $6,000 if coverage is needed. All in all, a family could be out of pocket by over $10,000, again, simply by not knowing how to take withdrawals out of the accounts. Third is, I looked at an example of somebody having an income of $200,000. This might be an example of somebody wanted to pay off their mortgage, maybe sold a business, sold some extra real estate. That premium goes up to $1,066 per month, $15,000 deductible, and $18,800. So as you can see, the numbers make a big, big deal. And so don't let affordable health insurance scare you. Just know how to navigate the system. And if you are worried and want to know how to navigate healthcare before age 65, transitioning onto Medicare at 65, and or protecting your assets from long-term care, give our office a call. We'll provide you a couple of solutions and ideas and help you navigate to minimize your healthcare expenses.
This is one of those situations where what you don't know may actually hurt you, especially when it comes to your pocketbooks. Take the time, figure it out, and maybe it works out where you can go ahead and the one thing that's holding you back from retiring, healthcare, is actually more manageable than you thought. But you don't know until you have that conversation with someone like the team at America's Retirement Headquarters. ARHQ.com is the website. Set up a time there, find out more about the team, or you can give a call 419-794-3030.